From hilarious movies, cartoons, the goat of physical comedy, Mr. Bean at the operating room. In this video, I'm going to be reacting to surgery with Mr. Bean. Don't go anywhere. Before I start this video, kindly give this video a like and also subscribe to this channel for more valuable health-related content just like this. Let's go.
Dr. Jacobson?
Yes?
We need you urgently in OR3.
No, can do. I'm doing number 4 at 1.
Sir, it's urgent. We have a ruptured kidney and massive bleeding.
Okay.
Rupture of kidney. So when you talk about rupture of kidney, is a medical condition also known as renal rupture, and is a serious medical condition where the kidney tears or bursts due to trauma, causing severe bleeding and potentially life-threatening conditions. So probably that was what the patient was facing, rupture of kidney, also known as renal rupture.
Hey.
Did you realize this? It's like he took the stethoscope with, I don't know, less confidence. Just take a look at this. The way he took it, I don't know if he is actually a doctor over there, because he took the stethoscope with less confidence. And but what if he's a doctor actually? Anyway, but then let's talk about the stethoscope. The stethoscope falling on the floor could get damaged, especially with the earpiece side. And also, it could be possible that it's falling, it can trap certain microorganisms or dirt which may contaminate it if not cleaned properly. So the stethoscope falling has a lot of disadvantages associated. The earpiece getting spoiled or it's trapping certain microorganisms.
Yes, it's urgent. What's happening?
Surgeon's on his way up.
At last, Dr. Bean.
Hello, doctor. We've got a 45-year-old male, type B negative, brought in by paramedics 10 minutes ago. He's got
Just look at how they just came to take him, start dressing him up, this, that. But I feel like that's not the order of dressing. The way they dressed him up with the nose masks before certain things, I feel like that's not the order of dressing to the theater room. But anyways, let's see what goes on. But he didn't even wash his hands or use a disinfectant before going there. Okay, anyway.
Yes. Gotta get him in there right now.
Doctor, it looks like a bullet in the lower thorax. Seems to have ruptured the lung, and there's severe inner bleeding along the abdomen.
Doctor, he's coming too.
All right, give him a T70.
Did you realize? If you realized something, I don't know if you realized it, when he entered, he looked so confused. That's why I'm asking myself over here that is he really a doctor? Mr. Ben is so funny. He looked so confused when he entered into the theater room. And look at this. You are on you are about to they are about to perform an operation, and then the doctor holds his nose mask. Even in the first place, he's not supposed to hold the nose mask down, because you don't know, as I said earlier in my other video, microorganisms are almost everywhere. Even the nose mask could be contaminated in one way or the other with certain microbes. So it's not advisable that he touches the nose mask with the gloves, because in the first place you are going to be operating the patient with the gloves. So you've touched the gloves, you've used the gloves to touch the nose mask, which we suspect might be having certain microorganisms which may be very dangerous if they enter into the stomach of the person, because I think the surgery is centered at the getting to the stomach abdomen level because of renal rupture, right? So it would be at the abdomen level. So he might even introduce microorganisms to that part, because he's not supposed to touch the nose mask. And let me talk about this. You are in the operating room, and the doctor just comes. Like, look at this. The doctor just does this. What are you going to think? You'll be like, which doctor is this? Which doctor is this? That's Mr. Bean for you, the goat of physical comedy. He's very goated for comedy, honestly. I like his movies, his cartoons, everything. They are very nice. Another mistake over here. So he actually brought food into the theater room. That's why I'm asking myself that is he a doctor? Because in the first place, even in our various labs, in my school, we don't send food to the lab. We are not allowed to even send food to the lab or even drink because we do a lot of stuff there and you don't even know what you might be putting in your mouth, especially at the microbiology lab. You don't know what might be contaminated and you are drinking there. So it's not advisable to be drinking even at the lab. How much more at the theater room? So he brought something to eat. Okay, let's see what goes on. Look at this. He held it with the gloves. The gloves that he has used to hold certain things, like the I saw him taking the instruments from the other doctor. He held that instrument, and you know, as I've always been stressing on this contamination. You don't know what you are holding. It might be contaminated with certain microbes or microorganisms, and you might not have any idea about that because you can't see microorganisms without an aided eye. But look at, he just took the food or toffee, I don't know, from the wrapper. Let's see. And he threw the wrapper away. He threw the wrapper just like that on the floor. Still back to, you might even be giving room for microorganisms to grow if the wrapper is not taken away from that area that he dropped it. It's very advisable that we maintain good hygiene wherever we are. Don't be dumping um refuse anywhere just like that. Look for a bin and then just drop it inside so that we don't encourage the growth of microorganisms. Look at this. Look at this. He just drew it and then now it has fallen into the sectioned area that they have to conduct the surgery. It has fallen inside. Look at all this. This is so funny. One of the medical series I've watched that is very funny. Mr. Bean. In the first place, placing his whole hand placing his whole hand into the sectioned area is also another thing I have to talk about. I don't really know, but is he supposed to place his whole hand inside just like that? And me, by this time, I feel like the gloves has already been contaminated, like with several things. I think you should even change the gloves because, anyway, what's that? Okay, so I think this is what they are supposed to remove so that it could. Yeah, I think this is what they are looking for. But how is he placing? Look at what he's doing. So now he has decided to open the whole thing like this, as if he's opening a luggage or something. Hey, so he's solely looking for his stuff, not about any other material, and he found it. He's washing it. I just hope it's not what I'm thinking. Let me know in the comment section below what you think about this series. What you think about this particular movie. Yes. He ate it. Honestly, I didn't expect him to eat it. Honestly, because just tell me in the comment section, would you have eaten it? It has fallen inside the section area where they are going to conduct the surgery. He washed it and he ate it. Hey, like seriously. Wow, I don't think a doctor would do that. No, 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 no. I don't thi- and this is just a movie, so yeah, but in real life I doubt. In real life I doubt. So please let me know in the comment section what you think about this movie series. Please comment. Let me know what you think about this movie series, because I want to know what everybody watching this particular video thinks about this series, Surgery with Dr. Bean.
Sorry to keep you waiting, sir. Nice work in there, people. Now back to the bleeding. Where's this?
Now, because
We gotta clamp it off.
of what he did,
J17.
it has made the patient bleed. It's causing bleeding instead of, unlike how it was at first. I don't think he was bleeding too much at first, because when they came they were like, the patient is bleeding and they can't even see well.
I can't see a thing.
CNS is 14 over
More
20.
suction.
Crazy bleeding. Somebody check that line.
Pressure's bottoming out.
Okay, hook me up at 12, please, now.
His heart rate is dropping. We're gonna lose him.
14 gauge.
The heart
Come on, people,
rate.
he's crashing on us.
I'm not getting a reading.
Where is this bullet?
Hang in there, fella.
Come on, hold on to it. If we don't find it, he's a
Doc is saying no, 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 you guys cool down. Yes. Mm-hmm. Hey, Doc. Mm-hmm. 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 Eh. the, the blood pressure is now getting back to normal. Ish. So I feel like he just used some strategy to remove that thing, because you see at first he removed that particular thing, and I think he didn't place it deep, so he knows where he placed it. So he came back to remove it, and now the person's blood pressure started coming back. So why is that initially he didn't just take it out? Okay, anyway. But the whole thing is funny. The whole thing is funny. Dog.
Damage to the brain is a very sensitive thing to observe, so maybe we should just step outside and give the doctor a little room to work.
Okay, yeah, that is very true. I think here it's everywhere. I guess it's everywhere. When a doctor is, even not just the doctor, whenever there's an operation being conducted, they advise, not advise, they just let the family members and loved ones step out, and then they conduct their process. They don't allow any other person to be there. Yeah, so this is very right for them to step out.
Jennifer, wakey, breakfast ready.
But what was he thinking about? If it was about wiki, I guess the family members would have done it long time ago. Wiki, they say simple. If it was about wiki, the family members would have done it already. So I don't think it's about wiki or Dr. Bean. He said wiki. Jennifer. Jennifer is just asleep. Wake her up. Hey, now there he has turned into a hey, wow. Maybe methods of waking someone up, because hey, I see. Dr. Bean. So the second method did not work. So the first one, he said wake, he didn't work. The second one was that one too did not work. So let's see the next one. This is one thing I've talked about earlier. Holding the nose mask. Holding the nose mask. Have you realized I've not counted, but the first part, the renal rupture part, he held his nose mask. This part, he held his nose mask, and he's not even wearing a gloves. Contamination. I've talked about it several times, because I want you to know what I'm talking about. I want you to concentrate or focus on what I'm talking about, because contamination you can easily get contaminated with microorganisms, because microorganisms are almost everywhere. We inhale some. So if you start creating some for yourself, just imagine you're already inhaling some, and now you are also doing certain things that can also encourage microorganisms. You get me? So anything that you are going to do that is going to encourage the growth or availability of microorganisms, you have to stop, especially when you're at the theater and you're holding your nose marks a lot. I don't think it's a good practice actually. Yeah, so that's one mistake I've been observing throughout this movie. Hey, wake up with vigorous. Now he has climbed the bed. Oh, hey, what kind of what kind of method of waking someone is up is this? So this is the third method which didn't work. We are counting. This is the third method. So let's see if he is going to bring another method. Let's see the fourth one. So the first one, he came wakey wakey. She didn't wake up. The second one, I think, what was the second one? The second one was when he came and then he did rah. Yeah, that was the second one. And then the third one is when he came and wake up. And he even climbed the bed. Still, she didn't wake up. Jennifer didn't wake up. Let's see the fourth method. Automatic. I guess you are looking for. You might have seen this instrument in movies and maybe you were wondering its name. So the name of this instrument that Dr. Bean is holding is automated external defibrillator, and it is used to treat someone whose heart is not working suddenly or whose heart has suddenly stopped working. But who said her heart has stopped working in the first place? I don't really understand why he went to take this particular instrument to use, but let's see. Let's see if it's going. He has not even plugged it in the in the first place. Anyway, this is the fourth method Dr. Bean has used. Let's see. Let's him plug it. Let's see if it's going to work. Anyways, so what happened? What happened? That he just threw himself just there, and it's worked. It worked. So Mr. Bean Dr. Bean has been using tactics to wake patients up, tactics to treat and heal patients. Wow. And the girl was waking up. Oh, hey. Wow, 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 wow. I salute. I salute Doc. Wow. I'm so surprised. So he has been using tactics, strategies to wake patients up, to treat patients. Wow. And then he ended up successful anyways. This is one of the comedy medical VM movies. Yeah, medical movies I've watched. It's nice. It's very funny too because we have Mr. Bean in here. So I hope you like this video. If you found it helpful, please give it a like. And also if you are new here, kindly subscribe to this channel for more valuable health related content. Thank you for watching to this point. Thank you very much. Have a nice day. Bye. See you in my next video.